Medicare Part D is the fourth component of the Medicare program. It's commonly known as the prescription drug benefit. Part D subsidizes the costs of enrollees' prescription drugs and their prescription drug insurance premiums. And subsidize is the key word here. Enrollees still have to pay some of their own money for this coverage. CMS funds Part D benefits, but like with Part C plans, the Medicare Advantage, CMS does not directly administer Part D. Instead, they contract with private payers and offer a fixed amount per Medicare enrollee. So the two key stakeholders here are CMS and the plan administrators, and here's how it breaks down. CMS outlines the handful of drugs that must be covered by all plans. They set the monthly rate that will be paid to all plan administrators, and they regulate the plans to ensure adequate competition. But they have no direct control over how plans structure their benefits. So on the other side, the plan administrator is responsible for that, for establishing the complete list of drugs the plan will cover, negotiating payment with drug manufacturers, and then determining what to charge patients for that coverage. It's technically a voluntary program, but most Medicare enrollees receive some type of Part D benefit. That benefit can be obtained in two ways. The first is through a standalone prescription drug plan. That's typically purchased by individuals who are enrolled in traditional Medicare, Parts A and B. Enrollees can choose between a number of plans that vary by the types of drugs covered, the monthly premiums, and more. The second way, though, is to obtain Part D benefits through a Medicare Advantage prescription drug plan. As a refresher, in addition to combining Parts A and B benefits, Medicare Advantage plans frequently include Part D benefits as well, so enrollees can receive prescription drug coverage through them. Now, in line with the rising spend across the other Medicare programs, Part D spending is also expected to increase significantly over the next decade. And that's not very surprising, given the fact that older Americans tend to use more prescription drugs. Still, of particular note is the rising cost of specialty pharmaceuticals, which is driving providers and payers across the board to look for ways to save money through value-based care arrangements with manufacturers and encouraging adoption of biosimilars and generics. Part D's capitated payment structure theoretically creates an incentive to do that for plan stakeholders to reduce unnecessary drug spending. But to incentivize even greater focus on value-based care delivery, CMS is rewarding Part D plans with direct bonuses if they're able to meet certain cost, quality, and patient experience benchmarks.